What is autism spectrum disorder? Autism spectrum disorder is a neurological condition that affects how a person interacts with others, communicates, and processes sensory information. The term spectrum means that symptoms vary widely. Some people may have mild difficulties, while others require significant support. This video explores causes of autism, how to identify autism, levels of autism, ADHD versus autism, and applied behavior analysis to treat it effectively. So please stay with us, and don't forget to like, share, subscribe, and comment to our channel for more health-related information. Causes of autism. Genetic factors. Autism tends to run in families. Environmental triggers. Factors like premature birth or parental age might play a role. Brain differences. Research shows differences in brain structure and function in autistic individuals. How to identify autism. Autism symptoms can vary by age and individual, but common signs include in children delayed speech development or unusual ways of communicating, difficulty understanding emotions or nonverbal cues, repetitive behaviors like lining up objects or repeating words, echolalia, extreme reactions to sensory input, loud noises, bright lights, textures, fixation on specific interests such as numbers, maps, or train schedules, autism in adults, struggles with social interactions and small talk, prefers routine and structure, dislikes sudden changes, sensory overload in noisy environments, malls, concerts, may struggle with employment due to difficulty in communication. Autism test. How is autism diagnosed? Parents and teachers often notice early signs around age 2 to 3 years. A pediatrician or psychologist may recommend MCHAT, Modified Checklist for Autism in Toddlers, a screening tool for young children. ADOS-2, Autism Diagnostic Observation Schedule, a structured test used by professionals. Genetic testing in some cases to rule out other conditions. Autism Simulator. Experiencing the world differently. What does autism feel like? Many autistic individuals experience sensory overload. Bright lights, loud sounds, and crowded places can be overwhelming. Some autism simulators allow neurotypical people to experience sensory hypersensitivity, delayed processing, and social difficulties. Popular autism simulators. Autism shows sensory overload in real time. National Autistic Society's VR simulation helps people understand social challenges. Autism in women. Why is it misdiagnosed? Girls with autism often mask their symptoms to fit in, leading to late or missed diagnoses. Key differences. Girls may have fewer repetitive behaviors or make better eye contact. They often mimic social behavior, even if they don't fully understand it. Many are misdiagnosed with anxiety, depression, or even ADHD. Levels of autism. Understanding the spectrum. Autism is classified into 3 levels based on how much support a person needs. Level 1. Mild autism. Needs some support. Struggles with social skills. Level 2. Moderate autism. Needs more support in communication and daily life. Level 3. Severe autism. Requires significant assistance for daily functioning. ADHD versus autism. How to tell the difference. Both autism and ADHD affect focus and behavior, but are very different conditions. Autistic individuals struggle with social interaction and sensory processing. People with ADHD have trouble focusing and controlling impulses. Many individuals are diagnosed with both ADHD and autism, comorbidity. Applied Behavior Analysis Therapy, ABA, treatment and support. Applied Behavior Analysis, ABA, is a therapy based on the science of behavior and learning. It helps improve useful behaviors and reduce harmful or unwanted ones. Purpose of ABA: to teach new skills, to improve communication and social behavior, to reduce problem behaviors, to promote independence. Steps in ABA: 1. Assess the person's behavior and skills. 2. Set clear goals. 3. Create a personalized plan. 4. Teach skills using positive reinforcement. Monitor progress and adjust as needed. Importance of ABA in autism: helps children with autism learn communication and social skills. Reduces challenging behaviors. Encourages independence in daily life. Improves overall quality of life for the child and family. Speech therapy: helps with verbal and nonverbal communication. Occupational therapy: develops skills for daily activities like dressing or eating. Sensory integration therapy: helps autistic individuals manage sensory overload. International Autism Day. Why it matters. April 2nd is World Autism Awareness Day, recognized by the UN.